Hemostatic system disturbances in ischemia. First, we will introduce ourselves and the identification of the patient.
Hi, I'm Dr. Elena. What's your name?
My name is Sarah.
Okay. How old are you?
45 years.
What's your address, please?
Lenin Street.
What's your nationality?
I'm Brazilian.
What's your occupation?
I'm a teacher.
And what's your marital status?
I'm married.
Then we will proceed to the subjective examination to further understand the conditions of the patient. Ask about history of previous diseases, family history, and drug history.
And what brought you here today?
I have a pain in my left arm.
Is it the first time it's occurring?
Yes.
How long did it take the pain?
2 hours.
Do you have any additional complaints?
Yes, I have numbness on my fingers.
Okay, and can you tell me how your period is? Is it normal or not?
It's irregular.
Okay, and do you bruise easily?
Yes.
Do you have gum bleeding?
Yes.
Do you have gastric ulcer?
No.
Have you ever had stroke?
No.
Tuberculosis?
No.
Any blood transfusion?
No.
Have you ever had operations?
No.
Diabetes?
No.
Do you have allergy of something?
No.
Okay. And do you have any other comorbidities?
Yes, I have a rheumatic disease.
Okay. Any other?
With mitral stenosis.
And do you have arrhythmia or something?
Yes, and arrhythmia.
Okay. And do you use any drugs?
Yes, for arrhythmia.
Okay. Do you go to the cardiologist regularly?
Yes.
After, we will do objective examination, where we can observe general inspection, palpation, percussion, auscultation of all systems of the body. Once we have gathered all information from the patient, we are able to have a conclusion about the hemostatic system. In the case of this patient, she has rheumatic disease that leads to damage of mitral valves, causing stenosis and damage of endothelium. The damage will activate platelet and coagulation, so thrombi will be formed. According to Virchow's triad, we can conclude that the patient has high coagulability, change of vascular walls, but no slow blood flow. We can conclude by this that the patient has high activity of the hemostatic system. We can conclude with the blood test that the patient has hypercoagulation disorder by observing the abnormal results in bleeding time, clotting time, and prothrombin time, for example. The results are lower than normal. Also, cholesterol and glucose for diabetes is not good, which will worsen the state of the patient. This information will be useful when giving the treatment for her. As a final diagnosis, you will tell the patient that she has rheumatic disease of the heart and explain what this means, that is, the scarring of the valves and damage that leads to formation of clots in the heart chambers. One of these clots has moved away and went to the brachial artery, causing the blockage of the blood flow, and that is why she has insufficient circulation in the arm, coldness, numbness, and pain. You can also ask for examinations such as CT scan for myocardial infarction, angiography of arteries of foot, MRI of the carotid artery stenosis, ECG, a handheld Doppler ultrasound for carotid artery stenosis. As part of treatment, we will advise the patient to lose weight, have a healthy diet, exercise regularly, do the correct control of diabetes as well as hypertension, and use some medicines such as vasodilators for better flow of blood, antiplatelet drugs to prevent formation of new thrombus, claudication therapy for pain in the arm, and myocardial infarction treatment.